We need to keep trying to slow it down.
Hopefully, we'll start to turn the corner. And
all those things will help us make sure we stay healthy.
Tim Seaman brings medical professionals together now for the latest updates in Siouxland. Coronavirus, changing times.
And good evening again, and thanks for joining us this evening for this KCAU-9 Town Hall. Coronavirus, changing times. I'm Tim Seaman. It's been a month since COVID-19 was first reported in Iowa, our daily lives being impacted ever since. And as we are learning, each in our own way, how to best navigate this crisis, we remain asking many questions and some still having concerns. But as our attitude of in this together continues to blanket Siouxland, there are also promising and progressive changes day to day. Once again, I am joined by leading members of the Sioux City medical profession, our two hospitals represented again tonight, as well as Siouxland District Health. And in the next half an hour, we'll be taking some time to take your questions and discuss other topics. You may remember it was a month ago when these three gentlemen took time from their schedule to join us then as well, and we look forward to continuing our discussion tonight. To get started off the top, though, first let's take a look at the most recent numbers that we can pass along. And they are here beginning with our United States numbers with more than 457,000 cases now reported, more than 16,000 deaths to report. The numbers, of course, closer to home are probably even more important, those that pertain to each of us. And in Iowa, case total now of 1,270 as of today. Nebraska confirming 567 positive cases after 44 new reports today. And Governor Ricketts, in fact, today asking folks to voluntarily spend the next 21 days at home. And in South Dakota, officials reporting 447 cases. More than 80 employees at Smithfield Foods in Sioux Falls have been tested positive there, and that facility is set to close for 3 days. Joining me tonight, once again, I'll introduce you to our panel that's with us. Closest to me, Tyler Brock, who is the Deputy Director of Laboratory Services at Siouxland District Health. Dr. Larry Voles, Mercy One Siouxland's medical officer and medical director at Unity Point Health St. Luke's, I should say, Dr. Mike Kafka on the far side. Gentlemen, again, thanks for all of you for being with us. Before we get rolling here, again, I want to take a look at the help that you can give us tonight. We're asking that if you have a question on the top of your head, don't hesitate. We hope that you'll pass it along to us through the use of Facebook. Just go to facebook.com/KCAU News, and then we'll try to pass those along to our panel that are with us here tonight. I mentioned numbers on a broad scope just a minute ago. We want to take a look at numbers from the Siouxland District Health, from Woodbury County, and from our region of Northwest Iowa tonight as well. Let's take a look first at these from Woodbury County from the Siouxland District Health. This is actually the RMCC numbers provided by the state for Region 3 that tonight showed just one patient hospitalized and one in ICU with a ventilator here in our northwest quadrant of the state. The beds available listed at just less than 400 there, with the ICU beds and the ventilators available at 51 inside our northwest quadrant. So let's just start there before we take a look at the other numbers. Are those numbers, do you think, and there's the Woodbury County numbers right there, I guess, that were out just from earlier today with the positive cases of just 12 here in Woodbury County, 97% of the tests coming back negative. So let's just talk about those numbers. Tyler, I'll let you start.
Yeah, I mean, if you look at the numbers statewide, we've clearly been fortunate here in the northwest corner for sure. We have seen a lot less cases than they have over in the eastern and in the central part of the state, and we're thankful for that. We expect those numbers to keep coming up, and you know, there's no real difference between eastern Iowa and western Iowa. Sure, they might have a little bit more population, but it's still Iowa, right? So there's not a lot of reason to think that this is going to be so much higher over there than it is to here. But again, we'll take it while we have it, and you know, you can see the numbers, and they're fairly low right now, and we're here ready for more if they pop up. The preparation continues. It's been going on for months, and that's especially true in our health facilities. As Tyler mentions, we've been lucky here in that we haven't had growing numbers by 20s and 30s each day. Has that helped in your preparations at those medical facilities as well?
Absolutely. I was going to say it's given us time to
think through our surge planning and identifying new areas within the hospital, opening up some areas that we've had sitting quiet, getting additional beds, creating more emergency room space, trying to build up our stockpiles of personal protective equipment, and cross-training a lot of our staff. There's sort of a lull in the hospital census right now, so we're taking people, nurses from different areas, and making sure they're familiar with how to work in the ICU and other areas they may not be working at normally. So they're ready in case when the surge comes and we get really busy, everybody can, all the hands on deck, as we say. So.
Go ahead.
I think it gives us an opportunity to learn from other parts of the country too. I mean, so much of this is New York is dealing with their surge, and other parts of the country they're dealing with this. We're learning treatment options and things that are being more tried and true, and we're not right at the front trying to figure this out as we're doing it. We're going to be able to learn from what they're experiencing there. So, Governor
Reynolds earlier this week said that about a quarter of the positive cases in Iowa were related back to healthcare workers. Are we, how are we ranking here inside Sioux City, Woodbury County, do you think, in that respect? Are your people being able to stay healthy in the hospitals?
I think our staff is at risk every day.
Right.
I mean, and the challenge with this is that they're really at that front line dealing with people that are the high-risk population walking in, and so our healthcare workers are at risk. We're doing everything we can to protect them through that and make sure that we have enough protective equipment to get through the entire ordeal through this pandemic. But our staff is at risk, and to think that we're not going to have staff impacted by this, I think, would be a misnomer. That 20% number is concerning, and I think particularly if we're to lose healthcare workers, or if that number gets higher, even than it is now, and patients or providers are out for an extended period of time, it could really affect our ability to manage this when it gets busy.
That relates also to news we got late this afternoon, Tyler Brock, from members of Sioux City Police Department, that the first essential services department in our city is now reporting positive tests, and that's from our police department. They said several officers have tested positive. Again, it seems like, in my mind, I would have expected that maybe a week ago or 2 weeks ago, and that we've been fortunate in that our work is keeping those people safe and the people that they come in contact safe.
Yeah, it just goes to show nobody's immune to this, right? And, you know, especially whether it's our healthcare workers, whether it's other folks around here, whether it's our police officers or fire, it's there for everybody. You know, nobody is immune to this, and especially people that are out and about. They're in the public. They're dealing with patients. They're dealing with sick people and that kind of thing. The risk is going to be a little bit higher, and you know, the fact that Sioux City PD is reporting that, that you're right. It is nice that this is the first that it's occurring, and we've been doing things for weeks now to make sure that number stays low in our most important folks.
Folks at home have been doing research, obviously, on their own. We'll get to your questions and some poll results that we've taken this week as well. But I thought maybe now that we've learned more, we're 4 weeks down the road, to take a look back and give just a brief explanation of exactly what this virus is and how it works. In layman's terms, and not at great length, but between the three of you, explain how this actually does attack our respiratory system.
I'll take a shot at that.
Go ahead, Dr. Kafka.
Virus, after someone sneezes, droplets in the air enter the patient's or person's nose, gets down in the throat. There are some very specific proteins that that are on the surface of the cells that line the lungs and the trachea, and that virus will attach to that specific protein and then is able to enter into that cell. And then it hijacks that cell's ability to produce proteins, particularly ones that it needs to make new viruses, new copies of itself. So it ends up generating hundreds and thousands of copies of itself, and eventually usually exits the cell, damages the cell on the way out, and then is able to infect all the neighboring cells. So you're talking about hundreds of thousands of other cells that end up getting infected. Initially, the infection starts up in the upper airways where the initial virus enters, eventually works itself down in the lungs and ends up damaging the lung tissue and the lung air spaces as well. And as that happens, the fluid starts to leak into the lungs and fills the lungs up with fluid, and you can no longer get air in and out like you normally do to get oxygen and carbon dioxide exchange. So your oxygen levels drop, and then the rest of the body suffers from that. The heart, the brain, the liver, the lungs, kidneys, and they stop functioning as well. And so it ends up being a major challenge for the entire, it ends up being a kind of a multi-organ thing besides the viral pneumonia that develops.
Can I have COVID-19 and not have a fever, or is a fever mandatory Is that part that says I have this?
Yes, several people have, there's a lot of folks with COVID-19 that don't have the classic symptoms, okay? There's a wide range, of symptoms that folks have. So you name it, all the way from high fevers to virtually undetected fevers have been documented in the cases that we've seen, and I know other health departments have seen that as well. Okay, let's check the first question here we've got that have been sent in from earlier today. Can mosquitoes spread the virus? I think this has been bannered around again, but guys, go ahead and clear this up for us.
No, at this point, mosquitoes don't have anything to do. It's person to person. One person that's infected, coughing, sneezing, or getting things on the surfaces that end up entering another person's body and ends up causing the infection.
Dr. Bowles, is there any more information on reoccurrence of COVID-19? We talk about you get the flu, you build up some immunities. There's been discussion about that. It's awfully early to have a solid diagnosis here, but what have you learned in the last month about that?
So I don't think we really have any more data to say necessarily whether people can get reinfected or not yet. There's still data working towards a vaccine, but whether once you've had it, whether you can get reinfected or not, I don't think we have a solid answer on that yet. And it's something we really need to clarify, because we certainly hope that once you've been infected, you can get back to work. But I don't think we have a solid answer yet that you can't get reinfected. I think the presumption is going to be that you can't, but I don't think we're convinced enough yet that it's going to be that you can't get reinfected yet.
Yeah. We have Dr. Caffey, go ahead.
This virus has only been around for 90 days.
Sure.
So it's really early to see if there's enough brand new cases that are coming up to be able to figure out who's getting it maybe for a second time around. So it's going to take a while to sort that out.
Flattening the curve is something we've been hearing for weeks. Tyler, here in Siouxland, it seems like we've been mostly flat. Mm-hmm. Do we expect a true peak, or do you think we may be able to just mound it?
It's opinion at this point, whether or not we're going to see a real spike or not. I think we have kept that relatively flat. I mean, the whole point of flattening the curve is to keep it from getting to a level that overwhelms our medical system. And we've been able to do that so far, and the hospitals have done a fantastic job of clearing space and being able to accommodate a lot of patients. And I think that curve is pretty flat now. I'd be guessing right now if I say, to predict if there's going to be a big spike or not. Hopefully we can keep it fairly level.
All right. I want to ask about that same type of topic when it comes to our Facebook poll. I want to share one that we've got here from just a little bit earlier today. Facebook poll, we asked Siouxlanders how much their lives have changed in the past month. That is reflected in that curve, I think, a little bit. And 66% say a lot, 34% told us just a little. And that, of course, continues on a daily basis as our lives continue to change. Let's talk a little bit about a couple of other questions. Face masks, we're seeing a lot about that in our community as the community's rallied different industries, different people that are in the seamstress industry coming together and making those masks. The recommendation tonight for mask use here in Sioux City, what would that be?
I think the cloth masks don't necessarily completely protect you like they would an N95 or a surgical mask from virus transmission. The cloth mask does some things for you. What it does is it keeps you from touching your nose and your mouth. It's a constant reminder that we're in this world where we have to be very careful around that. And I think it prevents obvious droplet transmission of that. But as far as aerosolization of somebody coughing on you, preventing that, it's not going to eliminate you from getting the virus. You still have to social distance. If you have to leave the house, then you need to wear it. But the key part is really staying away, washing your hands, and making sure you're not touching your face. And the mask is a reminder of that, can help, I think, some of that. But it's not going to keep you completely safe. You can't walk into someone's room that's infected and expect you're not going to get infected with it because you're wearing a cloth mask.
And while we continue the conversation, we'll put up a graphic from the CDC that highlights some of these different steps that people can take. Dr. Caffey, you had a comment.
I was going to say the most important mask is the one that's on a person that is infected and doesn't know it. It's stopping his droplets when he coughs and sneezes from reaching someone else, and it interrupts that part of the infection process.
Tyler, I want to come back to you again. It's been roughly 10 days since we've had our drive-through testing service, taking samples there. I know that on a daily basis you're taking dozens. maybe just quickly update us on that situation and the help that that's providing.
Well, I think it's the Siouxland Community Health Center has done a really good job of kind of leading that effort. They're doing a lot of the specimen collections and processing all those samples and processing all those test results, and they've done a great job. It's provided a place for us to be able to preserve some personal protective equipment. That way we don't have to have all that kind of PPE in every single clinic all the time. We can send folks to one place and we can preserve that. I think it's been, I can't speak for the doctors, but I assume it's been relatively easy for them to refer patients and to make it relatively simple and a pretty streamlined way of getting that done. And it's enabled us to get a lot of testing done. It really has. And we're glad that it got organized.
Will there be testing, and again, this is a hypothetical, I apologize in advance, but at some point, will there be testing to know that there's not a reoccurrence or that it is safe to move forward? I haven't been tested. I haven't got a positive test, sure. But at some point I want to make sure, as I move forward.
Well, I think testing is going to be ongoing. I think COVID-19 testing is going to be going for quite a while. I assume that there's going to be some antibody testing, which isn't really very prevalent right now, which will tell us if we've been exposed to it and we've built up, possibly built up some immunity. I'm sure that's coming down the road here pretty soon. So COVID-19 testing is going to be with us for a while.
This isn't something that's going away after we get through the peak or the flattened curve. It's a new way of life for us, isn't it?
Yeah.
We've got a Facebook question here we'll get to real quick, and we thank the folks at home that are participating tonight. Why does it seem like most of Woodbury's COVID cases are young adults? I don't know that that's the truth. That's a question from a viewer, so I'll let you decide. Yeah. Is that what feedback can you give us there?
There haven't been that many.
There haven't been that many. That's right. Right. There haven't been that many. It's a small sample size.
Right.
So, I think nationwide the cases are all over the board. All age groups are affected. I think right now you're just looking at a small. It's probably just kind of a random thing that's happened because we haven't had that many cases.
Our numbers are low, and I would assume part of that has to do with early action in our long-term care facilities. That was an aggressive action that took place well before we started to have numbers seem to populate. And where you look at the large caseloads, it is where there are residential facilities that have been impacted.
Yeah, no, I think that's one of those things that we're able to learn. By being a little further away before it started here, we were able to identify some of those risks. And the nursing home or the long-term care facility in Washington was obviously a tragedy that the rest of the country was able to identify and learn from, and really lock those facilities down and make them very much safer. So, with no visitors going in and out, trying to really keep tight on that has been a big help.
I want to talk about telemedicine here as well. That's something that's been really rolled out to try to help take people from having to make a trip to the doctor's office or whatnot in maybe a non-COVID type related assessment. Telemed here in Siouxland, how would you describe that? Has it been successful so far? Do you see a lot of it?
I think it's been very successful, and I think it's a huge help, and I think it's actually going to change medicine really going forth. I think each practice, each of the primary care providers and specialists are all seeing patients, and the patients, so I currently use it in my practice, and I think those patients really appreciate the fact that they're not having to drive in. We see patients that can drive really far to have to be seen, and if you can do a follow-up visit and they can do it from their living room and not have to drive in to see that, and then it doesn't put our staff at risk, it doesn't put, they're not wasting their time having to drive that far, and it keeps them from the additional exposure. I think it's going to be something that's going to be here to stay going forth.
Plus, within the hospital, we have televideoing so that there's carts that go into patients' rooms, and nurses and doctors can be outside having conversations and assessing them and limit their amount of time that they have to spend within that 6-foot distance with patients and whatnot. So the televideo thing is something we're ramping up right now, just thinking that that's going to help keep our providers safe and still be able to provide some good medical care.
Learning across the board during this crisis, that's for sure. Another poll question that we'll pass along from earlier this week, we polled our viewers, do you feel safe? A simple question, and it's pretty much split down the middle. I think perhaps. Tyler, maybe you could comment on that.
You know, I think that's, you know, look at it, it's literally almost split down the middle, and I think there's the risk is there for everybody. But I do think that it's worth noting that of the 400 or 500 tests that we've done of symptomatic folks, 97% of those are negative. Okay, and I think we can take some comfort in that. While there's a lot of COVID-19 around, and we know that there's a lot of these tests that we're doing. A lot of these people that have got some of these symptoms are negative. So not everybody that you're walking past has got it, you know. So I think, do you feel safe? Everybody is at potential risk, and yet there is this sense that there's a large percentage of the population that won't be affected by this, you know, from a health standpoint.
And again, it comes back to those simple steps. It seems, and I'll let the doctors comment here, if you follow the very simple steps that have been laid out, it becomes, I won't say impossible, but very difficult to actually become infected.
That's correct. Yeah, I was going to say the social distancing, hand washing, cleaning shared surfaces and things that you share with other people, phones, keyboards, things of that sort. That interrupts the whole transmission sequence and yeah, keeps people safe. So yeah, I think we're seeing the effect of that. The fact that people, I think, in Siouxland are doing a good job, and I think that's why our numbers are staying as low as they are. And I think we're going to see a bump rather than a spike for our own cases once it gets a little more entrenched in the community.
I want to ask you about snowbirds. What should they expect as they begin to come back from warm weather states, now that it's finally going to be warm here in Iowa? And what, as a resident, should I expect, conversely, with those snowbirds when they come back?
Well, I mean, I can comment. Just, we're asking people that are coming from out of town to quarantine themselves for 14 days. And that doesn't really matter where you're coming from. That's mostly travel in general at this point, is to be a 14-day quarantine, just because of, you know, just the risk in other places and that kind of a thing. So that's one thing that they can expect right away, is to be asked to lay low for a couple weeks.
Another question that we can jump to here is, we've been keeping track of our Facebook questions. This one, can a person have influenza and coronavirus at the same time? Is that possible?
Yeah, they certainly can. They can have both at the same time. The likelihood of having those two diseases at the same time is low, but it is possible. And so many times when we test to see if they have flu, but just because you had the flu doesn't mean that you didn't have coronavirus. So you have to be cautious of that.
A quick comment for women that are in the middle of pregnancy. We've done a couple of stories talking to mothers. Your recommendations for pregnant women here in our community?
Well, I know that we're getting geared up for them in our obstetric department, in the labor and delivery department up at the hospital. I think the number of people, the number of pregnant women that we have experience with from China and whatnot, there wasn't a large group that was in those that were actually infected. So I think the question is still out there, just in terms of how dangerous this is potentially to the woman if she were to get infected during pregnancy. They do tend to have a higher susceptibility to things like influenza, just because of the immunosuppressive altering effects of pregnancy. So they may be a little more likely to come down with it and maybe have a worse case in terms of how severe their respiratory symptoms. I don't believe that they think there's any chance of it being transmitted via the placenta to the infant. However, following the delivery is where the concern is. If the mother really does have it, then they need to be very careful about making sure that the child doesn't get infected as well. So there's a lot of hand hygiene, masking, and things that would have to be done for the mom to be able to work with the infant afterwards.
Tyler, I want to come back to you about testing. I should have asked this earlier when we're talking about drive-through, but there was discussion a week ago about the Abbott test that had been rolled out that was a 5-minute turnaround. I know Governor Reynolds said that the state was getting many of those, and I think 15, if I remember right, and they would be distributed across the state. Any word is there one in Sioux City, or any word that we would be getting one?
You know what, I'm not 100% sure if I've heard that, yes, there's a good chance that at least one or more places here in Siouxland will have one, but I don't know exactly. I don't know if you guys have heard anything from your lab or anything like that or not, but yeah, that's going to be something that'll come down the road, and you'll be able to get test results really quick. And that'll just be one more tool in the tool belt to try and get into quick diagnosis.
Dr. Bowles?
Sure. So there's two systems. The Abbott system is the much quicker system, 13 minutes to a positive and 20 minutes to a negative test. Cepheid is the first one that got emergency use authorization through the FDA. That's a 45-minute turnaround time. So we will have that at Mercy One. We have the hardware, and we expect the rest of the testing kits to be in town here within the next several days. So that will be a big turnaround for us. The challenge is going to be still getting the testing kits. So because we have the fast turnaround, that makes it quick. So if a healthcare worker thinks they have symptoms, we could test them right away. Or inpatients, we could test right away and get an answer. It doesn't mean that suddenly now we can open the floodgates and test 600 people a day, just because we'll still be running short of kits. Once we can be able to get the swabs, that we can swab people and not have a shortage of that, then we would have the ability to do that much quicker and be able to screen more masses and really be able to identify who's carrying the disease. So
an important step once that becomes available, another tool, as you say, in the tool belt. We're winding down here in our last couple of minutes. I want to leave each of you with a chance real quickly here to leave a final thought with folks as we move forward and continue to fight through this together. Dr. Kafka?
Oh, just keep reminding folks what they need to be doing, washing their hands, covering their cough, keeping their distance, wear a mask if they go out in the public, and if you're not feeling well, stay home, and just do all those healthy things that you need to do, and that helps keep the level of the infected people to a minimum throughout the country.
Dr. Bowles?
My concern that I have now is with the Easter weekend coming is I hear people talking that they're going to still be spending the holiday with their families because they're family. Family can still spread the virus just as much as a stranger can. And so bringing 20 family members together, even traveling and bringing in your parents into town to celebrate the holiday, you can still put them at risk. So it's really, we have to practice our social distancing. It has to be every day. And just because we're flat doesn't mean that we aren't still at risk for having a surge.
That's a great point, and we hope that folks at home will think of that as we move towards this weekend to spend time with family, but to do it cautiously and to be protective, and we'll all continue to stay safe. We thank you for joining us tonight. We hope that this has been informative and help rest some of your fears, and we will continue to move forward together and get through this. Thanks for being with us.